Whoa, what's this? I just found an ancient jar in my spice cabinet with a sticky label that says only February. It smells vinegary and a little mysterious. Makes me wonder, is this blessing or biology experiment? Today we're answering that exact question, how to make safe, low alcohol or alcohol-free extracts you can actually use.
That image says it all. Reaching for something unlabeled and wondering if it belongs in the medicine cabinet or the compost. Hi, I'm Fiona. Today we'll be practical and evidence-forward. What solvents pull which compounds and how to keep homemade extracts safe and useful.
And I'm Samnang. We'll walk through 3 kitchen-friendly demos: a cold vinegar infusion for digestion, a glycerin and honey cough syrup for folks avoiding alcohol, and a small batch low-alcohol tincture with clear dilution math and alcohol-free swaps. We've invited 2 experts, Lena Park, our clinical herbalist, and Dr. Mira Alvarez, a practicing pharmacist. Welcome both. So glad you're here.
Thank you. Happy to be here. I love turning everyday pantry items into gentle remedies that actually get used. We'll keep everything culinary dose and clearly labeled so listeners can feel confident making these at home. Thanks for having me. I'll focus on how extracts can interact with common medications, who should avoid alcohol-containing preparations, and how to communicate safely with your clinician if you're unsure.
Before we begin, quick note for our listeners. We have a downloadable cheat sheet in the show notes with dilution math, labeling templates, and a medication interaction checklist. If you plan to make any of these, grab that first so you can follow along.
Okay, segment 1, why solvent matters. Lena, short version. What does alcohol extract that vinegar or glycerin doesn't? And what should listeners realistically expect from a kitchen extract versus a concentrated clinical product?
Great question. In simple terms, different solvents pull different kinds of molecules. Alcohol is excellent for extracting both water-soluble and alcohol-soluble constituents, things like alkaloids, some bitters, and essential oil compounds. Vinegar, especially apple cider vinegar, tends to pull acids, minerals, and certain water-soluble bitters. It also lends a bright culinary acidity. Vegetable glycerin extracts sweeter, syrupy constituents and is gentle, great for folks who avoid alcohol or for making palatable children's syrups. Honey functions similarly when warmed gently and also adds antimicrobial support. But a kitchen extract is typically low dose, culinary or supportive, not the same concentration as a professional tincture used in clinic. So think of these as supplements to daily care, not replacements for prescribed medicines.
Nutritionally speaking, expect gentle effects. Improved digestion when used as a digestive bitter, a soothing cough syrup sensation, mild anti-inflammatory support from turmeric or ginger extracts used daily. Bioavailability varies. Alcohol can increase extraction of some compounds, but dilution math and small, repeated culinary doses can still be effective without high concentrations.
That helps set expectations. Lena, any quick rule of thumb for choosing a solvent at home?
Yes, pick based on the plant and the person. For bitters and culinary shrubs, choose vinegar. For sweet, child-friendly syrups or someone avoiding alcohol, choose glycerin or honey. For deep extraction of resinous roots or woody bitters, a low-strength alcohol tincture works, but we'll show a small, diluted option and an alcohol-free swap.
Segment 2. Dr. Mira, tell us about interactions and special cautions. What are the main categories of medication interactions our listeners should know?
3 quick categories to remember. 1. Anticoagulants and herbs that affect clotting. Think high-dose turmeric, willow, or large amounts of ginger. 2. Sedative interactions. Some herbs amplify sleep meds or benzodiazepines. 3. Herbs affecting liver enzymes, particularly the CYP family. St. John's wort is the classic example, but other herbs can change drug levels. For alcohol-containing tinctures, remember, pregnancy, breastfeeding, people in recovery, and young children should avoid alcohol or use alcohol-free swaps. My practical advice? Keep doses small and culinary. Think a teaspoon or dilute drops, and always check with your pharmacist if you're on prescription meds. Use the checklist in our cheat sheet. List your meds, search for each herb on a reputable interaction checker, and ask your pharmacist if in doubt.
That's excellent. And clinically, when we talk about small culinary doses, what does that look like? Lena, can you give an example?
Absolutely. For a digestive vinegar infusion, a culinary serving might be 1 teaspoon to 1 tablespoon before meals diluted in water, not a concentrated medicinal dose. For a glycerin cough syrup, a half to 1 teaspoon for children above recommended age thresholds, and 1 to 2 teaspoons for adults, taken a few times daily. For low-alcohol tinctures, dilute a few drops to a teaspoon of water or tea so the effective alcohol per serving is very low.
Bridge, quick checklist before our demos. Jars and lids, fine mesh strainer or cheesecloth, measuring spoons and cups, labels and a marker, vegetable glycerin, apple cider vinegar, raw honey, fresh herbs or dried equivalents, small amber bottles for tinctures, and gloves if you'd like an extra layer of sanitation. Anything to add, Mira?
Add a notebook to track batches, and a thermometer if you're heating honey or water. You don't want to overheat honey and damage beneficial enzymes. And always sterilize jars by washing in hot soapy water and pouring boiling water over them before filling. Digestive vinegar infusion. I'll read the ingredient list slowly so listeners can jot it down. Ingredient list: 1 cup apple cider vinegar, 1/4 cup fresh chopped gentian root, or 2 tablespoons dried gentian. Gentian is very bitter, optional. Or for a milder option, 2 tablespoons dried dandelion root, or 1 tablespoon dried ginger. 1 tablespoon grated fresh turmeric, or 1 teaspoon dried turmeric, as a flavor and anti-inflammatory note. Optional, peel of 1 orange for aroma. Equipment: a clean 16-ounce glass jar with lid, a fine mesh strainer or cheesecloth, measuring tools, and labels. Step 1. Place your chosen herbs in the jar. Step 2. Pour apple cider vinegar until the herbs are fully covered. Leave about an inch of headspace. Step 3. Put the lid on and give it a gentle shake. Step 4. Store at room temperature away from direct sun for 2 to 4 weeks, shaking gently every day for the first week, then every few days. Step 5. After steeping, strain into a clean jar, press the herbs to release liquid, and label with herb, solvent, start date, and a batch number. For use, dilute 1 teaspoon of the infusion into a small glass of water before meals. Start with a half teaspoon if you're sensitive to bitters. Storage: keep refrigerated after straining for up to 6 months. Discard if cloudy, fizzy, or off-smelling.
Quick note on swaps. If gentian is too intense, dandelion root or ginger gives digestive support with a more familiar flavor. Vinegar not only extracts bitter compounds, but adds acetic acid, which supports digestion and has culinary uses. Think shrubs or drinking vinegars diluted in sparkling water.
Love that. Makes it feel like something I could actually use before a heavy meal. Lena, any common mistakes to avoid here?
Don't overfill the jar so the herbs can move and the vinegar can circulate. Don't improvise with unknown plants. Stick to well-known culinary or known herbal ingredients. And always label clearly. That mystery jar is how confusion starts.
Segment 4. Demo B. Glycerin cough syrup and honey hybrid. Lena, read ingredients slowly.
Ingredients: 1 cup vegetable glycerin, 1 cup hot water, not boiling, 2 tablespoons dried slippery elm or marshmallow root powder, 1 tablespoon dried elderflower or a handful of fresh elderflowers, 1 cinnamon stick or half teaspoon ground cinnamon, and up to 2 tablespoons raw honey to taste for adults. Equipment: small pot, fine mesh strainer, clean jar, funnel, and amber dropper bottle if you want smaller servings. Step 1. Warm your water to hot but not boiling. Stir in the dried mucilage herbs like slippery elm or marshmallow root. The water will become viscous. Step 2. Remove from heat, add the glycerin and your floral or spice herbs, cover, and let steep for 8 to 12 hours at room temperature or in the fridge overnight. Step 3. Strain well into a clean jar, pressing gently. Step 4. For adults only, you may stir in up to 2 tablespoons raw honey once cooled. For a child-friendly version, skip honey for under 1 year, and for kids over 1 year, use 1 teaspoon per dose, depending on age. Viscosity tip: if your syrup is too thick, then with a little boiled cooled water. Storage: refrigerate and use within 2 to 3 weeks. Discard if it becomes cloudy, fizzy, or smells fermented.
Pediatric cautions. Honey should not be given to children under 1 year. For children under 2, always check with a pediatrician before routine herbal syrups, even glycerin-based, especially if they have chronic conditions. Patch test topically for skin sensitivity if your syrup contains ingredients like cinnamon or concentrated flower extracts.
From a pharmacy perspective, glycerin syrups are a good alcohol-free option, but check for allergies. Elderflower can cross-react with other plants. Also, if someone is on medications that suppress the immune system or has a severe chronic condition, consult their clinician before giving any herbal syrup regularly.
Segment 5. Demo. Low alcohol tincture with alcohol-free swap. Lena, walk us through a small batch tincture using fresh ginger as an example, and then show how to dilute it into a culinary dose.
Okay, ingredient list for a tiny batch. 1/2 cup chopped fresh ginger, 1/2 cup 40% ABV vodka, or use 1/2 cup apple cider vinegar for an alcohol-free swap. Clean 8-ounce jar and an amber dropper bottle for your finished tincture. Step 1. Place the ginger into the jar and cover completely with your chosen solvent, alcohol or vinegar, leaving some headspace. Step 2. Seal and store for 2 to 6 weeks, shaking every few days. Step 3. Strain and bottle. Now, the dilution math. If you make a tincture with alcohol and it comes out roughly 1 to 2 by weight, herb solvent, treat the finished tincture as a concentrated extract. For a culinary dose, start with 5 to 10 drops diluted in a teaspoon of water or tea. This keeps the actual alcohol per serving extremely low, usually less than a fraction of a milliliter. If you prefer 0 alcohol, use the vinegar swap and use the same serving, 1 teaspoon diluted, keeping in mind the flavor will be more acidic. To add perspective, if someone uses a few drops in a cup of tea, the alcohol consumed is negligible. Still, pregnant people, people in recovery, and some religious or cultural contexts should choose the vinegar or glycerin swap. Always label a tincture with solvent type and percent if known. Write vodka 40% ABV or apple cider vinegar on the label so there's no confusion later.
One more note on potency. Herbs like ginger are culinary and safe at these small doses. For bitter roots or potent herbs, use even smaller amounts and consult the cheat sheet for recommended herbs to avoid in pregnancy or with specific meds.
Segment 6. Shelf life, sanitation, and labeling. Mira, what should people watch for when they store these extracts? And when should they throw something out?
3 quick checks for spoilage: smell, appearance, and bubbles. If it smells off, sour in an unexpected way, looks cloudy when it shouldn't, or develops bubbles or foam, discard it. For glycerin or honey syrups, refrigeration is your friend and limits microbial growth. Storage 2 to 3 weeks is a safe window for homemade syrups. Vinegar infusions refrigerated after straining can last several months. 6 months is a reasonable guideline for home use. Tinctures and alcohol are very shelf-stable if alcohol concentration is above roughly 20% ABV. Low alcohol tinctures or vinegar extracts are less stable long-term, so date and batch number everything and use within the recommended window. Sanitation. Sterilize jars by washing and pouring boiling water over them. Use clean utensils, and if you're unsure about a jar's history, it's safer to start fresh. Labeling habit. Include the herbs, solvent, percent if known, start date, and batch number. Example, digestive vinegar, dandelion plus turmeric, ACV, started 2025-0601, batch 01. Keep a notebook or photo log. It's how you learn what works for you.
Segment 7. How to test it and bring results to clinicians. Fiona, what's a realistic 2-week micro-trial plan listeners can use to track tiny outcomes?
A simple plan. Pick 1 extract and 1 primary outcome. Example, digestive vinegar before a heavy meal. Outcome could be reduced post-meal bloating, rated 0 to 5 each day. Use the cheat sheet template: day, time, dose, outcome score, any other meds taken that day, and notes on side effects. Run this for 2 weeks. If you notice consistent improvement, 2 or more days per week of meaningful change, share that log with your clinician or pharmacist and say, I've tried a 2-week micro trial of a home vinegar infusion. Here are my doses and results. Can we discuss possible interactions with my blood pressure medication? That phrasing is precise and collaborative.
Exactly. Bring the label, the batch info, what solvent you used, and a list of your current medications. Pharmacists can check CYP interactions and anticoagulant interactions quickly. If any worrying symptoms emerge, unusual bleeding, dizziness, or new severe reactions, stop and seek medical advice. Reflection and encouragement. Start small. Try one simple extract this week, a digestive vinegar or a tiny glycerin cough syrup, and notice how your body responds. Keep notes, label everything, and keep it culinary. Herbalism isn't magic. It's patient observation mixed with simple technique. Your body knows a lot. Listen to it.
Fiona, one final summary. What are the key safety takeaways in 1 minute?
Keep doses culinary and small. Label and date everything. Choose your solvent to match the plant and the person. Refrigerate glycerin honey syrups and discard if spoilage signs appear. And check with a pharmacist or clinician if you take prescription meds or are pregnant or breastfeeding. Use the downloadable interaction checklist in our show notes before starting a new herb regularly.
Okay, friends, try one small extract this week. Take a photo of your labeled jar or record a 15 to 60-second voice note and tag @EarthyRemedy on social so we can see what you made. And don't forget the cheat sheet in the show notes for dilution math, labeling templates, and the interaction checklist. Lena, Mira, thank you for making this feel doable and safe.
Thank you. Have fun, stay curious, and start small. Real food, real results. Thanks. Be cautious, keep records, and ask questions. If anything feels off, stop and consult your clinician or pharmacist.
That's it for today's deep dive. We'll include timestamps and the full recipes in the show notes. Until next time, keep learning and be gentle with yourself.
Listen to your body. Trust the earth. Feel the difference. We'll see you next time on Earthy Remedy.